In this lesson, we are going to see what may happen coming back from your journey and which things you need to pay attention to. You may also learn which symptoms have to give you alert and need a medical consultation. Traveling means making great experiences and collecting many wonderful new memories, but the truth is that sometimes travelers come home with more than souvenirs. This means you can get sick from traveling. Fortunately, most after-travel illnesses are not a concern, with mild and temporary symptoms such as a head cold or an upset stomach. However, sometimes you may need to clear the situation going to the doctor. One of the crucial aspects of post-traveling diseases is that most common travel-related infections have variable incubation periods. Some infections will develop into symptoms generally into 1 month after the travel return, but some others can manifest symptoms even years later. For this reason, going to the doctor presenting him a detailed history that extends beyond the few months before presentation of symptoms can be very helpful. This is also the reason why it is highly recommended to see your doctor before leaving, to have a precise idea of your health condition and try to detect the cause of your illness precautiously. Depending on which other illnesses you're suffering in your life or at the moment of traveling, your susceptibility to infection increases, as well as clinical manifestations. You better give documentation about your vaccination and/or malaria chemoprophylaxis to be evaluated properly. Knowledge of your exposure during travel, including insect bites, contaminated food or water, or freshwater swimming, can also assist with the diagnosis. All these variables depend, consequently, on where you have been, not just in which countries, but also in which areas of the countries you were visiting. The length and purpose of your journey may have a strong impact on your health. The more prolonged is the exposure, the higher is the risk of infection or disease. So, people who are visiting their relatives are at higher risk because they stay longer, they have contacts with locals, and have the possibility of visiting remote and possibly dangerous areas. In addition, we need to stress the difference between staying in hotels, hostels, or even backpacking, because hygienic condition and risk of exposure can increase or decrease crucially. Now, we are going to see which are the principal symptoms or conditions that have to give you alert and need, eventually, medical consultation. The most common clinical presentations after traveling to developing countries are fever, acute diarrhea, and dermatologic conditions. Respiratory complaints are also conditions of importance in returning travelers. Fever could be a mild symptom caused by not serious illnesses, but it could also be the sign of medical emergency. When fever is presenting with other pathologies underlying, its presentation is peculiar, but you can follow general advice to give fever the right importance. For example, if you have been in a country with malaria and you develop fever within a month after you leave, see a doctor immediately. A fever could still be malaria even if you took anti-malarial medicine, because the medicine is not 100% effective. Most malaria develop within 30 days, but rare cases can lie dormant for a year or longer, so your doctor needs to know where you have been and even if your trip is far back in time. Even diarrhea is not an alert symptom itself, but it is recommended to see your doctor in case of persistent diarrhea for more than 2 weeks for 2 reasons. You can lose nutrients and could be caused by parasitic infection that need meds to be solved. Your skin could be very vulnerable if exposed to different environment, climate, flora and fauna, so it may happen to have skin problems coming back from journey like rashes, boils, fungal infections and bug bites. Most of these problems are not serious, but they could also be the sign of serious illnesses, especially if associated with fever. So now, let's see together which are the most important things you need to know about your coming back towards your healthcare. Whatever the symptom, make sure that if you go to the doctor after journey abroad, you tell him all crucial details, such as what you did on your trip, how long your journey was, where you stayed, hotels, hostels, tent, if you ate and drank something different or cooked differently from your diet, if you were bitten by bugs, if you took a bath in a recreational or natural fresh water, and any other possible exposure, sex, tattoos, piercings.